There's two things we need to do before 4:30. One is a Q&A. So any questions of clarification, things you want to know from the speakers, and maybe I'll ask Allison to come join us at the front. And Christina, thank you for staying with us a bit longer so we can ask questions.
Sure.
And then the second part of the discussion is basically a discussion that we would have together on what are some of the key messages that we want to convey back that we consider important to the rest of the group as tomorrow as it relates to education and awareness. All right, so we'll take some time to do that as well before we let you go at 4:30. But let's go to your questions, and I think we'll start, I'll take two questions in the room, and then we'll go to those folks joining us virtually. Go ahead.
What are we doing to teach the children at school in Canada? Can they recognize a tick? Do they know what a tick does? Do they know how to remove a tick? I know I work in a high school. My students know nothing.
KFLA Public Health, if you go to kflapublichealth.ca, you can go to our action plan. We do have pamphlets that we use at the schools, educational pamphlets for school boards, as well as for all the camps that we have to inspect camps, summer camps throughout our region prior to them starting up. We go and talk about safe water, accidents and injuries, and we always, for the last 5 years, give a talk to all camps on Lyme disease, early detection, prevention strategies, and with the school boards, we send out this type of information as well. So we can do more, but for the camps, especially where kids are out in the wilderness in our region, they get direct education, and the counselors, and the supervisors, and the nurses we bring in to educate them as well.
Okay, so hang on, and I'm going to try to make sure that as many people get an opportunity to ask a question.
I want to let you know that's not consistent. I don't know if that's consistent across health units in Ontario.
No, that's my next question. You know, you are in an endemic area. I happen to pick up Lyme disease in a non-endemic area, and I know that my grandchildren, my students in our school, we did a mental health awareness month for May, but we didn't do anything for tick-borne illness. This needs to be a Canada-wide project, not just because the area is endemic.
So that might be one of the key messages we want to share.
Yeah. So it's a KFLA Public Health Action Plan on Lyme disease. So in the back, Kingston, Frontenac, Lennox, and Addington, KFLA Public Health. .ca, and in our action plan we have some of the educational materials, and we try to be as accountable and transparent of how we're tackling this issue, and not to say we're the best at it, but if you want to bring this to your health agency and say, what are you doing and do you have an action plan, I mean, that's one way of getting change across the province, if not the country.
Okay. And that could be one of the messages we agree to. So again, let me take just one more question here, and then I want to make sure the folks online have a chance as well, and we'll come back here. Go ahead.
Hi, this is a question for Dr. Moore. I'm Dr. Marie Matheson. I practice here in Ottawa. My question is about the testing kits or the testing methods you're using to test ticks. As we know, the testing methods here in Canada for testing humans is flawed. So how do we know the testing that you're using for ticks is actually accurate, and maybe that more ticks are carrying infections than the 1 in 5 or the 1 in 6 that you're mentioning?
I'm not the right person for that, to be honest.
Well, you said...
I don't do the testing, so is there anyone here from the lab system?
But you mentioned yourself in your slides that 1 in 6...
I get the information from National Medical Lab and from Public Health Ontario, but I personally am not a lab expert, so I don't want to comment on...
So I guess my point is the research may be not accurate in terms of how many ticks are infected, and so it's giving this false feeling amongst Canadians that that's okay, you know, not all ticks have the infections, you don't have to worry about it. This is really a key point that I hear oftentimes in my practice.
And that might be another, again, good key messages to share tomorrow in terms of things we consider important.
Well, along that line, I think we can all, as public health units, be much more transparent and accountable to the public. Like we try to provide our epidemiologic data to be available on our website. You know, how many ticks are positive. The National Medical Lab that does the testing could also tell us transparently and accountably how they test the ticks. And I just don't have the expertise to comment on what PCR they use.
Right. Okay. Fair enough. Let me just see if the folks joining us virtually have a question. I'm going to ask the operator, do you have a question? Let's maybe start with the English channel, because I know that we have both channels. On va commencer avec le poste en anglais, ensuite on ira au poste en français. Operator, do you have any questions in queue for us?
Thank you. Please press star 1 at this time if you have a question on the phone line.
Is there a question for those
Once
of you?
again, please press star 1 at this time if you have a question. There are no questions registered.
Okay, so let's continue in the room, and then we'll come back to you, those of you joining us remotely.
Hi. I'm a nurse and an advocate and educator, and I have Lyme disease. My name is Cecile Goff, and I have a question for Dr. Zubek and Dr. Bested about the testing that you talked about. It was a great presentation, by the way. Because I get people asking me all the time, and I was an oncology nurse. That's really the only medicine I know. So in terms of Lyme, doctors I find aren't coming up with what test order, in my experience here in Ontario. So I get people asking me all the time, what test should we order? Like I asked my doctor specifically for the Bartonella test with public health, which came back highly suspicious, but infectious disease said it was false positive, of course. So what tests would you recommend? Because you spoke to that briefly, and I'm wondering about the PCRs for mycoplasma anaplasmosis.
Now, I believe I'm not supposed to mention any specific private labs or anything by name, so I want to abide by that. Although, if you do look on my website, which if you Google my name, you can find all that information of the labs I use. I generally use from the accredited Canadian lab in Ontario. What I generally do is what they call their chronic fatigue syndrome profile, which has C. pneumoniae, mycoplasma, HHV6 on it, a few other things. I take out the cytomegalovirus and I insert in Bartonella, and they do a DNA PCR test on that for both blood and urine. And
Repeat that
It's
more
on my
slowly.
website.
All
of that is on my website.
So your address, your website address.
LizZubek.com. LizZubek.com.
Okay. Let's get as many questions as we can.
Well, I have a quick comment really quick about the ticks testing. I just looked at the KFLA website and it was saying how it's 1 in 5 ticks. So that's even scary enough, I think, that data, even if the testing isn't positive, like that's still scary enough. But so my question is, I think it's for Christine. Was that her name? Christina. Is she still Christina? Yes, I'm here. Oh, okay. So I was just curious. She's based out of the U.S., right? Her information is mostly from the U.S.? Okay. Is it mostly from the U.S., the data you gave us?
Yeah, so the provider surveys, those are all U.S. providers. So that chart that I was showing you was there.
Okay, so my question is, how do you reach the general public? Because I saw like a few little things, but even like commercial TV-wise, like how much are people warned? Because it's like, it seemed like a lot of your data was like the people had to find it, you know what I mean? And like for me, before I had Lyme disease, I wouldn't have known to look for that information at all. So it's like what strategies are being used to reach out to the people before, so that they know about it before they have to go and look for it?
Yeah, that's a great question. You know, that's always the challenge, that we're trying to reach as many people as possible and get that information out there. So yeah, you know, the first step is developing the materials, and I showed some examples of those. And yes, you're correct. The next step is making sure people know about the materials. So, you know, the Lyme Core program that I mentioned, helping get the messages out there through writing newsletters and posting prevention signs and stuff like that, hopefully helps reach more members of the public. And we also work with state and local health departments. So they are, you know, within each state, and they have a very good handle on what are the populations that they can reach, who are the people that need the information. And so we try to support their educational efforts that way.
Okay, thank you, Christina. We'll take another question in the room, and then I'll check afterwards if there's any virtual folks asking questions. Go ahead.
Thank you. So my name is Asia Wright, and I'm here on behalf of MP Dan Rumi's office in Pitt Meadows, Maple Ridge, BC. So my question's kind of on a local level in our ridings. What can politicians do, and how can we be part of the movement of awareness and prevention? And I'm looking for some suggestions for our office.
Since I'm in your riding, I'll answer this one. One of the things that we need is protection, and you heard that in the other session, because as a doctor, I am sticking my neck out every time I do these N of 1 trials. I was shaking in my boots when I treated that little 4-year-old Donnie, but where else was I going to send him with that history? So protection for doctors who are following guidelines where they're evidence-based guidelines, but the research just isn't there to clearly state how long and with what you should treat and when to stop, that we won't have our licenses on the line or our hospital privileges or anything threatened because we're not following strict IDSA guidelines.
Okay, so let me just see if there's anyone online. Operator, can you tell us if you've got anyone in the queue?
Certainly, thank you. We do have a question from the French portion from Rochelle Guinard. Your line is now open. Please proceed.
Okay, go ahead.
Oui, bonjour. Est-ce que vous m'entendez?
Oui, on vous entend.
D'accord. Donc, mon nom est Rachel Guignard, je suis infirmière et aussi j'ai la maladie de Lyme, babésiose et Bartholina. J'ai une question parce que dans le CDC et aussi au Canada, au niveau épidémie, j'ai eu de la difficulté avec ce mot-là. Moi, ce que je voudrais savoir, est-ce qu'il compte les cas cliniques ou seulement les cas constatés, diagnostiqués par les laboratoires, que ce soit autant aux États-Unis et au Canada?
Répétez la question.
La question est de savoir les cas qui sont répertoriés. Donc, au Canada, depuis 2009, les cas positifs de Lyme doivent être déclarés. C'est une déclaration obligatoire à la santé publique. Ce que je veux savoir, en fait, est-ce que ce sont des tests de laboratoire qui sont obligatoirement tenus d'être positifs pour faire la déclaration, ou les médecins qui ont fait un diagnostic clinique sont pris en compte dans le chiffre total?
Okay, so not being an expert here in Lyme disease, I'm going to try to translate this question. So I believe that what she wants to know, and I don't know if you heard the question. Did you hear the question? Then, Christina, maybe you're better.
The question was, when you're reporting Lyme disease, is it being reported as a clinical diagnosis or is it being reported as a laboratory diagnosis? Do you have to have, in other words, laboratory tests in order for it to be a reportable disease?
Okay, and the answer, does anyone know what? You can answer in French. Brilliant, okay.
Les tests, okay, en Colombie-Britannique, c'est presque nécessaire d'avoir le laboratoire parce que la forme qu'on utilise, c'est très spécifique que quel est le symptôme, mais quand était le test laboratoire. So in English, in British Columbia, we have to say exactly when we did the test and what are the clinical symptoms, but when was the test done to confirm it. Mais avec KFLA, c'est une plus meilleure forme. KFLA is a much better form.
That asks for more information?
Parce que ça dit en KFLA, est-ce que c'est une diagnose cliniquement?
Ah, OK.
Was it diagnosed clinically in KFLA?
Dans le formulaire KFLA indique ça, mais pas tous les formulaires à travers le pays, si je comprends bien.
Oui.
OK, très bien.
Donc, les formulaires du Canada ne sont pas uniformes.
Oh, attendez, mademoiselle. Il y a une correction à faire. Yeah, we'll hand you the mic.
I've tried to fill out the forms in BC, and it was extremely confusing when we were doing it because I would tick off, they had the erythema migrans and they had the symptoms and everything, and then I got down to the bottom and it said, when was this diagnosis made? So I found as a clinician it was hard to use. That's awesome.
OK, alors la dame qui a posé la question, il semble y avoir un peu de confusion. Je ne suis pas certaine qu'on a une réponse claire pour vous.
Donc, si si je peux résumer, en fait, ce qu'on a comme données statistiques ne sont pas très fiables.
C'est ce que je comprends. So she's saying, so therefore maybe we can't 100% rely on the stats that we have. Et je pense que la plupart des gens semblent dire oui. Karen?
Oh, I think it's clear that there's underreporting.
Okay.
And we have to do better at communicating with our physicians that if we're going to have reasonable data for our regions, that they must report. It's too important to miss. It's one form. If we have to pay them $20 to fill it out, let's do it.
Yeah.
But we need better data and clinical data if we make effective decisions.
OK. Et mademoiselle, on va passer à d'autres personnes. Il y a beaucoup de questions. Est-ce que vous voulez terminer rapidement?
Oui, je voulais juste m'assurer d'avoir bien compris. Alors, ce que je comprends, c'est que c'est pas uniformisé dans tout le Canada.
Oui, vous avez raison.
Puis, c'est obligatoire, mais en fait, ça devrait être fait parce que là, les statistiques démontrent qu'il y a tant de cas par année depuis 2009, mais ce n'est pas vraiment la réalité. Là. On ne peut pas se fier là-dessus, on ne peut pas se baser là-dessus. Mais les médecins, quand on les voit, nous, c'est ce qu'ils nous disent. Ils sont formellement là, tenus à suivre ça parce que c'est des données probantes qu'ils nous disent.
Oui,
Alors, ce n'est pas vrai.
Vous avez raison, madame. J'ai beaucoup d'autres questions, madame. Si vous permettez, je vais passer aux gens qui ont d'autres questions. Merci.
Alors, merci beaucoup.
Merci. So let me just get to some folks in the room, and I'll come back again to the virtual folks.
Thank you. Hi there. My name is Aftim Nassar. I'm from Brockville. I'm one of your 2014 statistics that was positive. I'm here representing not only myself, but my two children who are not Lyme positive, and I want to keep it that way. I'm hoping that I'm articulate enough to bring this from one point to another. First off, I'm 43, and I understand the bonuses of pamphlets and handouts because I hate computers. However, as my young friend over here amply demonstrated, we're dinosaurs. There's got to be a better, more modern approach to delivering the information, to educating not only ourselves, but everybody else. And I'll give you a prime example of that, MAD. They took the current method of communication at the time being radio ads, then TV ads, and bombarded us and just were relentless about it. Now, drinking and driving is a social faux pas. It's not a how many can I drink before I drive and let's see if we can get around the cops. It is now a big no-no. That kind of ad campaign is something that we're woefully lacking here as far as Lyme disease goes. So I'm trying to say adapt with the times and let's change it up. Maybe get some kind of consulting organization to help us out here because I'm not the guy to do it. But now to my question. We try to educate everybody as to what's going on. Yeah, fine, I've heard a few things about Lyme disease for May, and everybody in this room knows, probably by Facebook or friend, that May is Lyme Disease Awareness Month. But nobody really understands it, what it is that you're trying to deliver other than, oh, there's some ticks. Nobody understands what it is that you're trying to do, such as we're trying to educate the doctors. That's great. We've talked about educating the children. That's great. But let's talk about educating pet owners, animal people that deal with the animals. For example, and this is where I'm struggling to get it through, rabies vaccinations. There's a program, national program, where they drop biscuits from the sky. I know, because I helped out with it one year. Hated flying around in that plane, but that's how they delivered the vaccine. That's how we reduced the issues of rabies nationwide. Is there anything where we can do that for the ticks, for Lyme disease? I would suggest that there is, not only putting it in those biscuits for the raccoons and everybody else, because ticks bite anything. Doesn't matter. Raccoon, deer, people. Heck, if they could get a fish, I'm sure they would. But if we could vaccinate the animals, that would help with the prevention, because everything is a three-pronged approach, right? Prevention, basically that means go get the ticks and kill them. Education, which is what we're talking about here with the doctors, and I'm suggesting we need to change it up for the kids, and treatment for all of us long-term sufferers. So would anybody here in the panel be able to address for me the issue of killing ticks? Is there anything that we could do, such as, and I'm offering the example as the rabies vaccination, which clearly works, the infrastructure's there, you can literally piggyback it. In a mass. Like, it took several years to do. It's still underway, but it has worked. Can we piggyback that? Is there anything like that?
I like the way you think. And you're basically saying prevention, and can we do better?
I can let the Canadians speak first, but I can add something as well.
Okay, so Christina, just hang on a second. Kieran will speak, and then over to you, Christina.
Christina probably has a better understanding of decreasing, integrated tick management in open spaces. So maybe, but in terms of communicating, this was about communicating with healthcare workers. We do have in our plan about how we communicate in a sustained manner with the public. I just don't know. You're absolutely right. Have I changed behaviors? That I don't care if they know more about ticks, but are they going to do a daily tick check? Are they going to use DEET? Are they going to decrease their personal risk? So that we have to do a lot of survey data and use mass marketing strategies to be effective at behavior change. We're good at tobacco. We're getting better at alcohol. Mother Against Drug Driving organizations. We can be better at tick management for individuals. And we do use social media. We use Facebook. We use the press, the radio, etc. But I honestly don't know. And perhaps this is a research question we should be addressing nationally. Are we changing behaviors, not just of physicians and healthcare workers, but also of the public at reducing their immediate risk for having a tick adhere to them? And I don't think there's really good science about arachnicides for deer and for white-footed mouse, but I'll leave it to my CBC colleague.
Christina, Christina, any thoughts on that?
Yeah, so I wanted to mention a couple things. There is some research on a vaccine for mice, specifically targeting white-footed mice, but any type of rodents. It's an OSP-A vaccine, outer surface protein A, and it is kind of rolled up in a bait, and the mice come and eat it, and then theoretically then they are vaccinated and resistant to acquiring Borrelia burgdorferi. So that's been studied. Maria Gomez-Selecki has published a couple, some preliminary papers on that, so you can look for that online. And also some of my colleagues here at CDC are also looking at the mechanism, trying to make the bait and the vaccine the most efficacious possible, and doing some field studies related to that as well. So it's a very good idea. I'm glad you brought it up, and there is some exciting research related to that. The other thing is bait boxes that are being studied currently. And what that is, it's a box that people can put in their backyards, and it's been studied usually 2 to 3 boxes per yard, depending on the size of the yard. And the rodent goes in, gets a little piece of bait, and then goes out of the box. And while they're in there, they're brushed with acaricides that kill all the ticks that are on the rodent. So that's been developed and is also being tested for efficacy and the optimal use conditions.
Thanks, Christina. Allison wanted to say something.
Yes, I think we also have vaccinations for our dogs. So if we vaccinate our dogs, we're certainly creating a screen around our family. So at least the dogs are not going to be transmitting the disease. But I also wanted to draw your attention to that Australian work that they did. This was a huge campaign in Australia because the skin cancer, both basal cell and squamous cell, was so high in melanoma. And they had this, you should go online, and honestly, I want you to all look it up, Sid the Seagull. Have a look at it, because it was this little cartoon, and he was basically talking away, and he was saying, put on a hat, slap on some sunscreen, and he did this whole little routine. And by doing that, promoting that in Australia for 5 years, they've dramatically reduced the skin cancer. This is the kind of slogan, and this is the kind of effort I think that's needed here in order to educate people and to get it into the kids. It was a fun cartoon, and also they backed it up with the schools. So if the kids came to school, they didn't have a hat on, they sent them home. So they reinforce this whole thing. So I think this is the kind of strategy that will be really helpful for the ticks.
There's at least 5, 6, 7 questions in queue in the room, and I do need to go eventually to the folks joining us virtually. But let's take a question in the room, and then I'll go virtual.
Thank you. Dr. Moore, in 2013, my daughters referral to the Kingston General Hospital's infectious disease clinic was denied by your colleague at Queen's University, Dr. Gerald Evans, because she had no recent bullseye rash. She never had the rare bullseye rash. She had the even rarer lymphocytoma, and she had been sick for 12 years. Can you tell me, would she today, if she went to, if she had a referral to the clinic, would she be accepted and seen by Dr. Evans or one of, or someone at the clinic? And I just want to add that within 7 months of that referral, she received a diagnosis for Lyme disease in Canada and received 2.5 years of treatment, and she is now in recovery.
Good. So have things evolved over time? Mhm.
I am so sorry. I can't comment on how a physician refers or accepts patients. I don't know Gerald very well. I don't know his clinical practice. I'm happy that your daughter's improved. I would hope that every physician in our area has Lyme disease high up in all of their differentials for undifferentiated fever, chills, myalgias, arthralgias, weight loss, neurologic, or joint problems. But I'm sure there are many failed investigations by clinicians in our area.
Still lots of work to do. All right, let me just go to the folks joining us remotely. Operator, do you have anyone for us? Any questions for us?
Thank you. Once again, as a reminder, please press *1 if you have a question. There are no questions registered at this time.
Thank you. I'm trying to respect the sequencing here, and I know you had your hand up a long time ago.
Yes, thank you. Thank you very much. My name is Shannon Coombs, and I'm with the Canadian Consumer Specialty Products Association. My member companies make DEET, the products that you were talking about today. And we're very concerned about consumer education, which is the reason I'm here today, to talk about some of the things that a few of the people here have mentioned. And one of the things I work on, of course, is talking to government. So I think that as a result of some of the concerns I heard here today, is that we need to ask for a specific campaign to educate consumers. It has to be very targeted, and it has to be targeted to social media and to the young people, millennials in particular, but also to educating our children. I have a 10-year-old boy. He goes to camp. So these things are very important that we teach them early on. So I think that if we can collectively agree that we could ask for a targeted campaign education program for children and moms and all the other people that were listed, I think the CDC has done a very good job, but we're very much committed to helping and educating as well, so we're here to help.
Thank you. That might be another key message here. I know that the woman at the front in the green t-shirt also has been very patient, so let me just run the mic over to you.
This question is for Dr. Moore from KFLA. Do you continue, even though your area has been endemic, to continue to test ticks?
We, as a health unit, don't accept ticks anymore. We do what's you may know of active surveillance. So we go to areas where we don't have much information on the ticks at present, and we go to those areas. We do active tick dragging and analysis of those ticks. Now, this was admittedly not something I wanted to have happen. It was a cost reduction issue. Would I like more active surveillance? Absolutely. And passive surveillance, but that was a limitation imposed upon us.
Because I come from the county, Hastings, Prince Edward County, and just 2 weeks ago they made the announcement that they were going to stop accepting ticks because it's reached that 20%. And I just think if you continue to do it, you're going to find over time more ticks test positive.
Yeah, as a public health physician trying to protect you, I want to know if babesiosis is entering. I want to know percent positivity is remaining high and or increasing. I want to know if anaplasmosis is present. And without a good passive and active strategy, we're going to miss out. So I have concerns as well on these reductions.
I'm hoping that some of your answers are being answered, or questions are being answered as we go, because we're going to run out of time. Go ahead, Matt.
I'm a family physician. I have a couple of quick questions. Do we still think that attachment time is important in terms of infection for Lyme disease? And the second question is, are we into a cycle where if there are no reported cases in an area, there never will be because physicians think that there isn't Lyme there and they don't diagnose it?
Well, I can address, I think, the tick attachment time. We used to think that you needed a minimum of 36 hours. We used to think that you needed a minimum of 36 hours in order for the Borrelia to be transmitted from the tick into humans. There have been numerous case studies now in the literature reported, and there have been hours with the transmission of the Borrelia. So I think that is really falling by the wayside.
So if you're referring to papers by High Note and Al of 2011, it was 3 people, and it was self-reported tick time. And when Ruben Kaufman, who's an expert in arachnids, looked at it and went and weighed the ticks, it was his estimate that the ticks were probably on people for 5 to 6 days. So I think there's still debate. Our guidelines are very conservative at 24 hours. If the tick's been on longer than 24 hours, you should think of getting prophylaxis. And I'm not confident that there's a lot of good science shorter than that.
Still a lot of questions, so I'm going to ask you to be brief with the questions and the answers.
Sorry, can I just mention that they've done 2 studies where they show that ticks attach and fall off and reattach. There were 2 studies with that. So just because the person says, well, I saw the tick go on me, you can't rely on that because it might have been feeding on somebody else earlier.
Hi, my name is Diane Quigley, and I am the advocate who runs the support group in Kingston in KFLNA. First, I would like to say that no, Dr. Evans would not take anybody. I myself have been denied access for both Lyme and Bartonella, which I am positive Canadian. So you have a lot of work to do with your associates. I wanted to talk about the KLFLA algorithm and how it is actually being used, and how it states that if the tick is under 72 hours of attachment, that you are not to proceed with anything, and to talk about your prophylactic 1-doxy. I have talked to 70 people in the Kingston area, and not one of them has received even 1 doxycycline. I've heard of ticks being thrown out at emergency, and people leaving with EMs and no treatment. So I'm hearing what you're saying about all these wonderful things that are supposed to be happening in KFLNA. However, I'm not experiencing it, nor are anybody in my group. So what are we going to do about what you've said and what is true?
So implementation sounds maybe like it.
I'm very sorry if anyone's being sent home with erythema migrans and not being treated. And that is a clinician decision. I can't change the 500 frontline healthcare workers' decisions on clinical management. I can provide them with the epidemiologic data, the surveillance, and I'm sorry if that's occurring. I know there's some discussion about whether to prophylax. It is in the Sanford guideline. This is a Bible that physicians use at the front line of healthcare, and the wording is, if an endemic area, if nymphal partially engorged deer tick, you can prophylax with 200 milligrams PO, 1 dose with food, and you can reduce the incidence. 1 dose. I'm just reading what this says, okay? And this is based on randomized control trials and a prophylaxis study in an endemic area. You can reduce the incidence from 3% in the control group to around 0.4%. So a significant, that's a 10 times reduction in the incidence of Lyme disease, and they follow these patients longitudinally. So it's one option that a physician has. It's not mandatory, it's an option that they can prophylax after an exposure with a tick. I think by the science, it seems reasonable that we can decrease the risk of an individual from 1 in 50 down to 1 in 250 chance. If it's removed within 72 hours, but been on the patient for more than 24 hours, they can get prophylaxis. Yeah, and that's consistent with the guidelines and consistent with this. No one can make it mandatory. I mean, we can only give them guidelines on available best practice. I can't force a physician to treat erythema migrans, but my God, I would hope they would, and if they don't, I hope we hold them accountable.
Okay, let's just go to, there's a lot of other questions.
Hi, my name is Arlene Rill, and I'm from Montreal, where there is no Lyme at all. We do have some ticks, but they do not carry Lyme. That was what I was told by the first infectious disease doctor when I researched the tick and went in with the bite. No Lyme in Montreal. I went back about 7 times, 8 times, and I was told that maybe I have a urinary tract infection, maybe I have osteoarthritis. Anyway, I learned more than he knows about Lyme, and he was the infectious disease doctor. And the rheumatologist also told me that the same thing everybody else is told, chronic fatigue, arthritis, everything. I left the hospital, went to another hospital, and I was told by that doctor that he's highly suspicious that I have Lyme, and put me on Doxy for 6 weeks. 6 weeks after 6 months of no antibiotics did not really help me. I'm listening to, and I have doctors who have said many things to me. Believe me, we all have, I'm sure, and many things we have said to doctors. But I'm listening to, Ontario, and I'm listening to BC, and I'm listening to all this fragmented information because a lot of it does not apply to Quebec. And people in Quebec, well, in the Montérégie area and in the eastern townships maybe, but it's not in Montreal. People are not aware of ticks. They're not aware of Lyme disease. They're not aware of ticks at all. There is no testing. There's no doctor in emergency there is nothing. So I'm feeling with all this that I'm having to put pieces of a puzzle together. And we're here in Ottawa, which is in Ontario, yes, but I think that because of who we are and why we're all here, all of us, each and every one of us is here to help people who have Lyme disease. But it's not helping us unless we come together as a nation. We must come together and have common ground. We really must. It's not working like this for anybody.
Those are wonderful comments and heartfelt, clearly. I think this discussion is great because we're clearly identifying gaps. We're not penetrating the medical community knowledge base, even on early identification and treatment. We're not penetrating the population and education and changing behaviors on preventing Lyme and preventing tick adherence. So you're right, we've got lots of work to do, but that's the purpose of coming here today, is to start strategizing on how we can do better from a surveillance vantage point, as well as a prevention vantage point, as well as acute treatment.
Okay, hang on a second, guys. No, you're answering the questions. Okay, I know that there's 2 people that I've already committed to get the questions. There's also, we were supposed to do something before 4:30, which was to kind of identify the key messages we wanted to share. Let me just ask you something, and then we'll go back to the questions. There's a colleague from FAC who has been taking notes on key messages. Given that we're not probably going to have time to do that together, would you trust me? I'm not with FAC, and I am a totally neutral person here. You guys want to leave it to me. If you want, I can sort of, from my own notes, pull out, and I think what I do, the focus would be on education awareness, because that's the focus of our workshop, is I would talk about, some of the key messages that we heard probably fall into 2 categories. Some are about the content of the messaging.
Can we take the next time and do that? Because I think this is essential. I would prefer to take the time to actually get the key messages personally.
Then the questions? Oh, okay. So let me just, because I committed to 2 people, I'm going to give them the floor, okay, just out of respect. And then we'll quickly get through key messages, and then we'll see if there's more time for questions. And if some of you can stay later, maybe we can go a bit later. Okay, but I'll come back to you in a minute, and you. But you're good. Okay, so, yeah, exactly.
I have a really quick question. Does it really matter if it was a nymph tick that bit you, or like an adult, male or female?
No, it doesn't matter.
It
they can still carry Lyme. Okay.
Okay, so I know there's other questions. Yeah, there's one behind me, and they're both pleading with me. 3 people are pleading with me. So I'm going to ask you guys, can you just hold for a second? Give me 5 minutes, okay? Give me 5 minutes. So there's one from you. There's the gentleman over here. He's a smart guy. He's a very smart guy. He says, what if it's relevant to the key messages exercise that we want to do? Oh, boy.
Okay, by way of introduction, Chris Martin from Lambton County, Ontario. My wife has been diagnosed with Lyme disease a year ago. And a couple of things, 30 years law enforcement background as a commander with the OPP. I'm currently a professor. I'm currently a professor with public safety at Fanshawe College. One of the things that's been instilled in policing is the fact that we have a responsibility to maintain the confidence of the public. And we have several civilian body oversights from SIU to OIPRD to OCCPC and on and on and on, and mostly to the public to maintain their confidence. And this seminar is on prevention. This seminar is about prevention. And doctor, even though you're doing a great job in Kingston Frontenac, you've had 2 people before you identify clear issues in your county, in your jurisdiction, that are issues that involve prevention so that the next person that steps into that doctor's office doesn't encounter the same problem that that lady had and that lady had. And you haven't even taken their name to identify what the doctors were, nor to identify the issues. So that's more of a point. And then I refer to the Lambton Health Unit, which is in an endemic area covering Pinery Provincial Park, which we live 10 miles to the south of Pinery Provincial Park. My wife had a positive Western blot, positive IGeneX test, symptomatic, and we got the call from the health unit, from a nurse from the health unit, that told us over the phone after we left the doctor's office 2 months after she took sick that, oh, you've tested positive for Lyme. You've got Lyme. So even though we just left the doctor's office, we drove to that health unit where we received misinformation from the nurse. Now, Ontario, the way Ontario operates, fortunately I've had the experience of that, health units have a direct reporting agency up all the way to the head of the province, to the minister's office, and all the way down laterally. So I read Lambton's health unit because I'm thinking, since there's an endemic area in Lambton County, that they surely would have taken the time to also develop an action plan. They have not. Furthermore, right on their site, I'll read it to you. Not all ticks carry Lyme disease. The American dog tick, which is the most common tick found in Lambton County, does not carry Lyme disease. The black-legged tick, which is not commonly found in Lambton, can spread the Lyme disease bacteria to humans. The misinformation exists across this province, and the very reason that we're here provides us with an opportunity to share that information about the fact that there is nothing in common, whether it be at a health unit or whether it be at a practitioner's office. So I challenge you, because earlier you said, oh, please go into your health unit and you can take this document in. There will be no change from any civilian who walks into a health unit to go to the chief medical officer for that county and say, oh, can you look at this? We'd like to implement that here. Change comes from top down in Ontario. It doesn't come from bottom up. That's the way it's worked. That's the way it'll always work.
Thank you, sir. Okay. Oops. Okay, so there's clearly, let's just identify some key messages, okay? And then if there's extra time and some of you can stay longer and our speakers can stay longer, we'll take your questions, okay? But we just got to get through some of these key messages, okay? So we've already heard there's a lot of misinformation out there. There's a patchwork of approaches and different types of information across the country, and we'd like to see some consistency. We talked about a national or across Canada campaign, right, that would be needed. I know that I've got colleagues who have been taking notes on key messages, so let me just ask them what they've been collecting. And as you listen to them, think about, are there any important ones missing? So what types of things have we got?
Hi, so I'm Tracy Townsend. I'm a policy analyst with Public Health Agency of Canada working on Lyme disease, just so you know where I'm coming from. But so I tried to capture what came out of the discussions, so please let me know if I've missed something. So I think we started especially talking about starting education early, starting education for doctors in medical school so that they have that information when they go forth into practice. Ensure that doctors have easily accessible, up-to-date information to make the clinical diagnosis. From Dr. Moore, who said persistent and consistent education for physicians is needed.
And for them to be
For
persistent.
them, absolutely. To educate our physicians so they can educate the public. Ensure that physicians have the information about ticks and the tick life cycle that they need. To emphasize that it's always a challenge to reach as many people as possible, but we need to do better at that. And how do we make sure that the messaging are actually changing behaviors? So what can we do to make sure that we can measure from what information we've put out there to make sure that it has an effect, that it is changing how people act in their life? Make messaging age appropriate for children, teens, including making sure that the medium itself is age appropriate, whether that's technology, online, websites, and that common materials should be available across Canada to make sure that local health, yeah, I can see your hand. Do you want to add something to that? No, it's okay. I just saw your hand go up. So I've got one more and then we can go back. So it just says the medical community is not being penetrated and there is a lot of work to do.
Yes, still a lot of work to do. So other key messages that you would like us to record?
Yes. In the education for doctors currently in practice and for med students, I would like to see education on the multi-organ and system presentation of Lyme disease, because patients are going in, this happened to me, and I've seen just about every ologist, and I kept saying, you know, if my neurologist, my neurosurgeon, and my endocrinologist, and my gastroenterologist, and my internal medicine, and my psychiatrist, if you guys would all get together and have a coffee, my life would be so much easier. I am a nurse. I've been a charge nurse in interdisciplinary rounds. Interdisciplinary rounds are not happening for Lyme disease. And then the other thing is there needs to be education around ethics and communication, because I don't know what the hell has happened in our system that there is an apathy. And this is not just for doctors. There needs to be education for frontline workers, including nurses, because as a nurse, I have received some frightening care in the ER because there's a stigma attached to it. When I present with stroke-like symptoms and a seizure disorder, I'm written off as psychosomatic. Oh, the burnt-out oncology nurse from small-town Newfoundland, you know? Little lost lamb in the woods, and then you're written off as psychosomatic, and that happens over and over again. I didn't believe it till it happened to me. I see it all the time in other people. So ethics, communication, and a collaborative multi-system organ approach.
Excellent, we have that down. Other key messages, your hand was up first.
And I know in Connecticut they use a system for teaching children in the schools through art. Grade ones do pictures, they draw pictures of ticks, and they actually do picture messages. Don't pick a tick out, all of that. That is in Connecticut. It's a very smart thing to do for a grade 1 student, maybe not so smart for a grade 5, but let's teach the little wee ones not to take something out of their body unless they know what it is.
Okay. Key messages.
Okay.
For now.
Okay, very quick. I have a huge issue with the 24-hour rule. My son, when he was 4, was bit. It might have been on him for 8, 10 hours at the most. So we need to remove the limiting 24-hour rule. The longer it's attached, the greater the load might be more appropriate. So not that you can't get it unless it's on for 24 plus hours. You could get it, but it might be a lighter load compared to a, you know, when
So
you have
change that message.
Change the
Okay.
load. Yes, absolutely.
Still has to be treated immediately.
Deny care because it wasn't on for 24 hours.
Absolutely. Okay, other key messages.
There is a stigma to Lyme, and doctors worry about treating people with Lyme. And they worry because of the College of Physicians and Surgeons and the attitude. So one of our key messages is we have to get to those guys particularly to admit. Another one that no one else has mentioned, it was mentioned in plenary, and that is people with chronic Lyme need disability. And that involves Health Canada and it also CPP. So those are messages that need to be brought to those people, because you cannot get disability even though you can't work because of Lyme.
Hello. Yeah. Hi. Hi. My name's Christine Fraser, and I just diagnosed last year with Lyme's, but I've had it for 14. So I would like to see that to stop the provincial colleges from charging doctors who are treating Lyme's, because they are the ones that open the door for us. So I think they should be respected very highly for making that move for us all to go forward. I also think that there should be a network, as you mentioned, but with everyone, patients, veterinarians, doctors, and researchers. And also that there be millions of dollars put into the funding that we've seen already to other causes, and that is a huge thing. It can be part of this event because it's federal. And I'd also like to say that everyone here, over the commonality is that we're all alone. You feel alone, but your voice as a one is strong, but I think we're really strong together this weekend. So I just want to thank all of you. It's wonderful. Across Canada. Thank you.
Hi, my name is Neil Macdonald. I'm an advanced care paramedic in Sudbury, Ontario. Just speaking towards our RNs and physician education. I do believe that emergency services and things of that nature, we do need a say as well at the collegiate level, as well as universities, not just the medical schools. Part of our job is evolving. We do community paramedicine now as well. So not only are we looking at acute pathologies, but after this weekend, I really truly believe that we need to start looking into possibly algorithms for early detection. Going back to this gentleman's point, the stigma with our physicians. If we go into an emerge department with these signs and symptoms, my questioning has changed in my own practice. It's very much where have you been? Have you been bitten? Have you been in a heavy forested area? Sudbury, we're not in an epidemic, but as far as I can gather from this weekend, things are migrating very quickly. So I think that could be beneficial as well in that setting.
For sure. I just want to make sure that the people I haven't heard from first, okay? Because I want to make sure I give everyone a chance. Madam, I don't think we've heard from you.
So I agree with our paramedic peer and the nurse. I'm a pharmacist, and I know zip about Lyme disease. So you have to educate all the health professionals. Not everybody has a doctor. Some people, for example, up north, only see a nurse, extended practice, I guess. But I mean, I get people dropping in. You go to any Shoppers, it's open till midnight. It's an ER, literally. So you have to educate all the health professionals.
That's a good point. Okay, others? Madam, and then over to you, sir.
Just a comment on passive surveillance. 2 weeks before Christmas, a neighbor of ours has 2 dogs, found ticks on each. So I wanted to save the ticks for surveillance, brought them to the veterinary, and was sent to Winnipeg. They were identified as winter ticks, and they were never tested because they're not supposed to be carriers. And I think that is a big lack.
Okay, so over to you, sir, and then I'm going to check with the folks joining us virtually.
Key message, as you asked, 5 words or less. It's this is a pandemic. This is a war, right? Kill the pricks, okay? Plain and simple, okay?
We might have to edit that a little bit, but we get the meaning. It's loud and clear. Yes, and I think the DEET representative has something to say about that. Okay, over to you, and then I'm going to check with the folks joining us virtually.
Okay, just a comment about you captured the key messages, and they're not very action-oriented. They're more observations, and I was hoping we could put some action words, because right now we could be covered under the 4 points of what FAC is doing around surveillance and education of consumers and education of practitioners, but I don't think it captures an action, and especially given the passionate.
Tomorrow, that's the point. But
But aren't we going to report back, though, as a group?
We'll report back on what was said today. Absolutely. So what was the action messages that you'd like to put?
Well, I heard that we want to have better education across all medical practitioners, including the pharmacists. I heard that we want to educate consumers and that we want better surveillance. And I wasn't too sure about the testing, if we had a request about better testing for the doctors.
Well, and maybe in terms of my report back, because this is the education and awareness, I'll certainly give a lot of attention to the education and awareness related actions that we're recommending as well as comments. And I expect the other two groups, there's a group working on surveillance and there's a group working on guidelines and best practices. So I'm sure they're going to talk almost exclusively about testing. So I just want to make sure that I give also a lot of importance to the education and awareness messaging from today. Let me just, can we see if from the operator, were there any key messages that those joining us remotely would like to share? The message, okay.
We do have a question from Michelle Hogg. Please go ahead.
Hi, I am Michelle Hogg. I currently live in Ontario, but I am from the province of Newfoundland, where I was infected 49 years ago. My question and observation is this. In 2006, I was diagnosed with fibromyalgia. That was my initial diagnosis. My health continued to go downhill. I was diagnosed in 2011 with Lyme disease. I have fielded a lot of questions from fellow Newfoundlanders who are familiar with my story, who have similar symptoms to mine, who have been told by their doctors, their specialists, that Lyme does not exist in Newfoundland, there are no infected ticks in Newfoundland, and that the only reported case was one little girl last year who was 4 years old who showed up with the bullseye rash. My question and my suggestion is, how do we educate people in provinces like Newfoundland where they are being told by the Department of Public Health, by doctors, by specialists that Lyme does not exist in Newfoundland? How do we address that issue? How do we get information into a province like Newfoundland? And how do we get healthcare professionals in Newfoundland to realize that, yes, there are Lyme-infested ticks in the province. People are becoming infected, and what do we do about this?
Mm-hmm. Would you like to share your thoughts on how best to reach all those people?
Well, what I have last night in my patient speech, instead of telling my own personal story, I decided to focus on 3 of the key misconceptions about the tick population in Newfoundland. Mm-hmm. Those observations were that recent studies and recent media has said that the tick population is growing in Newfoundland based on climate change and an increase in white-tailed deer. But in my research, I discovered that studies have been done on seabirds like the puffin, dating back to 1991 and earlier than that. So to state that there have been no tick populations in Newfoundland, no permanent tick populations, I think that that's a false statement. And I would like to see that some of this research comes to light. It is made public. Newfoundlanders are made aware that they can indeed become infected in Newfoundland, and to be educated.
Okay.
Doctors need to be educated there. Healthcare professionals need to be educated as well.
Yeah. Okay. Well, I believe that Liz has a comment to add. Madam, go ahead. Liz.
Well, just on towards key messages. I think a key message that we have to include is the role of patient preference. I really applaud all the work that KFLA has been doing and educating and all that, but again with that, there's an algorithm which is very easy for doctors. As a doctor, I love an algorithm because it just tells me what to do right away, but it's not like that in tick-borne illness, and so if we can educate physicians about the role of patient preference, that's not a new thing. We do it when we're discussing hormone replacement therapy at menopause. We don't say, oh, you turn 50, you have to take it, or you turn 50, you don't, or whatever. So we have to educate them to educate patients more fully and understand patient preference.
Thank you, Liz. There's another key message maybe?
Yeah, I just wanted to make a statement that he's a paramedic, I'm a dental hygienist, you're a nurse, we all have to update our CPR every year. Maybe this is something that the CPR people can implement in their program, and that way whoever's a healthcare provider that needs to renew theirs yearly.
That's a really good idea because it's a great way of reaching everyone on a regular basis, right?
So I think something we kind of missed was, like, we all know that the blood testing is not going to be good for a while, and same with the clinical trials. Like, we're not going to learn certain things for a while. So it's like in the in-between time while they're figuring that out, how are we going to make people aware of things like it's not proven yet if it's sexually transmitted, for sure. It's not proven yet if even through saliva. It's not proven yet through blood. All those things, like, that's not proven, but it's still a possibility. So it's like, is it worth it to warn people beforehand so that, like, are we gonna wait 5 years or whatever when the tests come out and then warn people, or should we tell them before? Because it's like, I said this last night, like any of us right now, because the ELISA testing is so inaccurate, we could go donate blood to anywhere right now, and then that could just be transferred to somebody else, right? So. For sure, yeah, because even if we're wrong, like, at least it's being prevented, right? So.
Okay, good. Okay, other comments, key messages that we want to share tomorrow? Education awareness.
Sorry, this is just quick. I have a friend whose daughter had a tick on her head. So she called me and in a panic, wondering what to do. So I sent her to the doctor and I gave her government forms stating what should be done in this tick. So she brought the tick with her. They couldn't identify what kind of tick it was, and they were not going to give her antibiotics. So she showed them the documents, and it showed what they should be giving, and she pushed. 3 doctors came in the room, had a conference on whether or not they should treat it or not. And our infectious disease has indicated that I've heard on TV interviews that we have 1 out of 5 of those black-legged ticks that are carrying the infection. She ended up taking the tick to the entomologist because the doctors couldn't identify it. It was a black-legged tick, but she had to fight tooth and nail to get those antibiotics. If we're telling people to do tick checks and telling them to wait for symptoms, we're not fixing the problem. And that's one thing that I would like in whatever goes forward in this framework, is how to handle cases like that. Because I know for me and what we've gone through, I wouldn't want anybody to wait, and I would give the antibiotics and be safe and save all of us a lot of hassle. But she only got them with 3 doctors and the letter from the government.
Go ahead, Allison. Thank you.
So I think that's one of I would like to see a major message change. If you do get bit by a tick, I really think you should get treatment with antibiotics. I think you've got a few pills worth a long life of misery. So from my perspective, I think we should change our message. And I think it's something that we have to, but we haven't decided on that. And this is a message that we have to decide as a group here. So, and I think this is and the other thing is that it doesn't matter if you live in an endemic area or not. The birds fly in, the birds fly out. So I don't think you need to wait to find out if you're in an endemic area or not. I think you should treat if you're bitten by a tick. That's my personal opinion.
Okay, so we will include that message for sure tomorrow. Absolutely. Okay, let me just ask you this, and then let me ask our speakers, are you able to stay another little bit? I don't want to force you to stay much longer, but yes, you're able to stay a little bit. Christina, can you stay a little bit longer?
Yes, that's fine.
Okay, so we'll continue with our questions.
An ounce of prevention is worth a pound of cure.
Thank you. That could be our motto.
Yes.
Absolutely. Okay.
I've been working with the Ontario Lyme Alliance, and we're the lobby group for Ontario. So we meet with the minister, and we're in the legislature, and we do all of it on volunteer on behalf of all of you. So I just didn't know if you knew about that, so please check out the website. But most importantly is what we've discovered, and I find appalling as a municipal worker that has contracted Lyme and lost a lot, like many of you, is that there is absolutely no communication from your legislature when a bill is passed to your public health. And there is no communication between each and individual public health, even though there's an association. We had the privilege of working with Dr. Moore on a conference call, and we were so grateful that he knew what we were talking about, because we weren't getting anywhere with anybody. And so you need to know that your minister and your MPPs need to have your letters, and communication, and we need to have a consistency of care and prevention. Hamilton is now 41% infection rate with ticks, and we haven't even told our public. We sent the report to public health, and I have a relationship with them. They're lovely people. But we've got day camps going out in the Dundas Conservation Area. We've got all kinds of kids that are going in different areas. I've been bitten 3 times in the Hamilton area. I'm an avid hiker and outdoorsman, and we are not taking the responsibility to communicate. Sudbury had horses. Wherever you have animals, we aren't even communicating with our veterinarians as to what they're seeing in dogs and what's happening in the public. You know, and the areas that are doing jobs and moving forward, it may not be perfect, but it's way better than anything else in Ontario and Canada.
Okay, good. Let me just, okay.
Just really quickly, I just want to say that I've been going around trying to advocate for Lyme disease and so on, and I went to the YMCA's, and I said, would I be able to meet with your camp director? Would I be able to meet with your counselors? Just to give them a heads up, to inform them. And the answer to me was, that would just instill fear in the parents, and they would not want to send their kids to camp. I said, are you freaking joking me? Let them get bitten by a tick and come home with Lyme disease? That's okay? But this is the mentality of the people who have not, the consumer, those who have not been touched by Lyme.
But you are raising a good vehicle, though, which is well, absolutely. Mm-hmm. Yeah, okay. Let me just see if there are people that are joining us remotely that would like to ask a few questions before we close. Operator, do we have anything?
Thank you. Once again, if you have a question, please press star 1 on your telephone keypad.
Okay,
There are no questions registered at this time.
Okay, good. I have a message here that just in terms of timing, the first shuttle bus back to the Sheraton leaves at 4:45 and the second leaves at 5:15. Okay, it's just to make sure everyone's aware of the logistics. So any other questions? I mean, so what's going to happen is, I hope you guys trust me to do my best with those messages. I'll report them tomorrow, and Dan's going to anyways open the floor. So, you know, if I've forgotten something or didn't get it quite right, you'll be able to kind of correct me.